Thank you so much for having me. I'm really excited to be here and to share the chapter that I wrote looking at and examining transgender sports bans as a human rights issue. I'm an associate professor of public health at the University of Nevada, Las Vegas. My pronouns are she and her, and I identify as a cisgender woman. And if you don't know what cisgender woman means, we're going to talk about some definitions in a few slides. But again, very happy to be here to share this information with you all today. So today's agenda, we're going to talk about some definitions of terms just to make sure that we're all on the same page about what we're talking about when we refer to sexual orientation or gender identity. We're going to talk about transgender sports bans, specifically looking mostly at the state level transgender sports bans that have been implemented across the United States. We'll talk about biological advantage of transgender athletes because that has been used to justify a lot of the transgender sports bans. Talk a little bit about the harmful rhetoric that has been amplified because of these sports bans and all of the media attention that transgender athletes have received in the last few years. And then lastly, and with looking at a way forward, how can we make sure that transgender athletes have access to sports participation, but it's also a fair playing field for cisgender girls and women as well. So we'll talk about that to close out this discussion. So just a definition of terms real quickly. Most of you probably are familiar with these terms, but often they get confused and often they're used interchangeably or synonymously, and they're not. So when you talk about gender identity versus sexual orientation, so gender identity is a person's internal sense of being a man or a woman or anything in between. So it's how a person feels about their gender identity. Where sexual orientation is described as a term, it's a term that describes a person's either sexual or romantic attraction to others. Those two things are completely separate. So you can have a gender identity and then you have a separate sexual orientation. And then a lot of these transgender sports bans look at sex, which is the sex that is assigned to a person when they're born based on their body parts. So, and again, a lot of these transgender sports bans really focus on sex and leave gender identity completely out of the equation. And again, we'll talk about that quite a lot throughout this presentation today. So just make sure that we have that baseline level for some of those definitions. So the term transgender refers to a person who identifies as something other than the sex that was assigned to them at birth. So a transgender male or man is a person who was assigned female at birth, but a person who identifies as a male. So if you look at the person on the left of the screen, this is a transgender male athlete. Transgender female or transgender woman is a person who was assigned male at birth, but they identify as female. So then the second, the middle, and the athlete to the right, these are two athletes who are transgender females. And then cisgender is a person whose gender identity matches the sex that was assigned to them at birth. So in the beginning, I said that I am a cisgender woman. So on my birth certificate, I was assigned female at birth and I identify as a woman. So I'm a cisgender woman. Then there are people who are born and they are intersex. So an intersex person is a person who is born with genitalia, gonads, or chromosomes patterns that represent both male and female simultaneously. And about 2% of the population in the US actually are intersex. So they have those characteristics of both male and female when they're born. Okay, let's get in and start talking about state level transgender sports bans. So in 2020, Idaho became the first state to enact a law that banned transgender athletes from participating in sports based on based on their gender identity. As of March 2023, now we have 19 states that have enacted transgender sports bans. And again, these bans do not allow athletes to participate in sports based on their gender identity. So they do not allow a transgender girl to participate in girl sports. They do not allow a transgender boy to participate in boy sports. In these states, a transgender girl, because they were assigned male at birth, would have to participate in male sports, and a transgender male who was assigned female at birth would have to participate in girls sports because they were assigned female at birth. So there, it leaves completely out this idea of gender identity. Governor Edwards, when he vetoed the Louisiana bill, which unfortunately that veto was overturned, and they were the 18th state to enact a transgender sports ban, said of the Louisiana transgender sports ban that it was a solution in search of a problem that simply did not exist in Louisiana. And actually, when pushed, a lot of the legislators in the states where these bans have been enacted can't say how many transgender athletes are participating in sports in their states, know of no transgender athletes that are participating in sports in their states. And one legislator went so far as to say that at that moment, she knew of no transgender athletes participating in sports in her state. However, the ban was to prevent some problems in the future for girls not being able to participate in sports. When really, if we look at the number of transgender athletes who participate in sports across the United States, it's a relatively low number of people. So of the 4 million student athletes who participate in sports in high school, less than half of a percent of them identify as transgender. Only 14% of transgender boys participate in sports, 12% of transgender girls participate in sports, and while of all students across the United States, about 68% of them participate in sports. So the number of transgender girls and boys participate in sports is very low. So again, maybe these bans are a solution in search of a problem that simply doesn't exist in some of these states. So this map shows you the 19 states that have enacted transgender sports bans. The states with the asterisk next to their initials, so Idaho, Montana, West Virginia, Indiana. There are temporary injunctions right now that are blocking the enforcement of those bans, but these are the states across the United States that have implemented transgender sports bans. So state level transgender sports bans require, again, athletes to participate in sports based on the sex assigned to them at birth. And forcing a transgender girl to participate in boy sports or a transgender boy to participate in girl sports limits opportunities for transgender athletes to participate in sports. Many of these transgender sports bans are targeted towards athletes K through 12 grade, and then some of them go as far as university. So kindergarten, kids as young as 5 years old are being targeted. These sports bans are being targeted specifically to them. Most of the transgender sports bans, although some of them include all transgender students, so both transgender boys and girls, most of them specifically focus on transgender girls and women. And a lot of them have been titled Saving Girls and Women's Sports. So they don't even consider transgender boys and transgender men. They specifically focus on transgender girls and women. Most of the transgender sports bans require some type of sex verification. Many of them, that sex verification is simple as providing a birth certificate that shows what sex you were assigned at birth. But some of the sex verification are much more invasive and intrusive. For example, Idaho Bill 61 has a clause about the sex verification. So if a participant's sex is disputed, and it can be disputed by anyone, it could be disputed by another athlete, it could be disputed by a coach from an opposing team, then the participant has to items the participant's sex by presenting a signed physician statement indicating their participant's sex based on three items. So the physician needs to do a physical examination of their participants' internal and external reproductive anatomy. They have to provide information about the participants' level of testosterone and also an analysis of the participants' genetic makeup. So for girls and women who are maybe lower income, don't have access to physician, this becomes a barrier to participating in sports. But it also, this dispute, so if anyone disputes a participant's sex or gender, then it allows people to call into question student athletes who don't fit the cisgender heteronormative expectations of femininity and masculinity. And there is concerns that that stipulations like this, as sex verification, will decrease not only the number of transgender athletes participating in sports, but also the number of cisgender girls and women participating in sports. State level transgender sports bans also vilify people who don't fit the cisgender heterosexual normative. A lot of these bills skeptically suggest that transgender girls and women have transitioned as a way of sort of gaming the system so that, say, a boy could say, "Oh no, I'm a girl," and have that lead to him winning, say, state track or something like that. So it's very skeptical of transgender people in general. A lot of these transgender sports bans additionally rarely explicitly acknowledge the existence of transgender people. Transgender girls and women in a lot of these bills are misgendered as biological males or biological boys and men, rather than identifying them with the gender with which they identify, which would be a transgender girl or a transgender woman. State level transgender sports bans also delegitimize gender identity. So this Idaho senator had a quote saying, "Boys are boys, girls are girls. No doctor, no judge, no Department of Health and Welfare is going to change that reality." So this rigid definition, if you are assigned male at birth, you are a boy and you're always a boy. If you're assigned female at birth, you're a girl and you're always going to be a girl. So this is the notion that a cisgender person, so a person who was assigned male at birth and identified as a boy and now as a man, can't possibly understand that someone might identify other than the sex that they were assigned at birth. So it delegitimizes this idea of gender identity, which we all have. We all have a gender identity. And some of the bills strictly define sex. So Arkansas Senate Bill 450 defines sex as a person's immutable biological sex as objectively determined by anatomy and genetics existing at the time of birth. And we know that transgender people, they can transgender medically, they can transgender surgically. And so some of these biological characteristics can be changed if they decide to do, say, a surgical transition. So it doesn't allow any space for that. You are what you are based on the sex that you were assigned at birth. And it also leaves out people who are intersex, right? Saying that you're either a boy or a girl. A very binary definition of sex is identified in many of these transgender sports bans. In addition to the state-specific transgender sports bans, a lot of the national and international sports bodies have developed either transgender sports bans or transgender policies. However, I'd like to just pause here before we move into these, and just recently, sort of hot off the press, in the US at the federal government, the House just passed a Saving Women's Sports bill, and it would be the same. It would not allow girls and women who are transgender girls and women to participate in sports based on their gender identity. It is likely that that bill will not pass through the Senate, but these sort of policies are being considered at the federal level, not only at the state level in the United States. So the NCAA, that's a governing body over college sports. They have, rather than a sports ban, they have sports-specific standards at which of which transgender women need to qualify to be able to participate in sports. Many of these sports-specific standards require that a transgender woman participating in sports needs to have a testosterone level of less than 10 nanomoles per liter. That's for the majority of NCAA sports. For a few sports, it's less than 5 nanomoles per liter. And then for women's polo, because they go with the FINA guidelines, it needs to be less than 2.5 nanomoles per liter. The International Olympic Committee had just recently updated their transgender policies, and they're leaving the specific policies about transgender women up to the sport governing bodies. So they themselves are not saying that transgender women need to have less than 10 nanomoles per liter. That was their old requirement of the guidelines that they came out with in 2015. But the new guidelines that they established in 2020 leaves it to the governing bodies. But in their framework for equitable competition of transgender people, they encourage the sport governing bodies to not only look at testosterone and not to assume that transgender women have an unfair advantage over cisgender women. FINA, this is a governing body that oversees swimming. They have their policy is that a transgender woman, in order to be able to participate in swimming events, needs to have transition or gone through gender affirming care before going through male puberty. And male puberty, based on this, is defined as they need to go through, like, get on gender affirming hormones or testosterone blocking hormones before the age of 12 or before they meet stage 2 on the Tanner puberty scale. And then, so having done that, then they also need to have their testosterone less than 2.5 nanomoles per liter. The International Cycling Union, they only have the less than 10 nanomoles per liter for transgender women to be able to participate in cycling competitions. The World Athletic, which oversees track and field, they just came out with their policies that that in order to participate in competitions, track and field competitions, a transgender woman had to have gone on testosterone blocking therapy before reaching male puberty. So that's before the age of 12 or before reaching that stage 2 on the Tanner puberty scale. And then any women who are like intersex or have a, some sort of a variation in their production of testosterone, then they need to maintain a testosterone level of less than 2.5 nanomoles per liter. International Rugby, their policy, again, that just came out in 2022, I believe, it just bans transgender women from participating in rugby until further notice or until more research is done to create that policy. So a little bit more information about this. So the NCAA there is a demand for the NCAA to disallow, and again, this is misgendering, but to disallow males from competing in female sports. This demand letter comes from ICONS, which is an organization that's promoting protection of women's sports. And the human rights has concerns about this idea of not allowing transgender women to participate in sports, this male puberty aspect. So this would mean that a transgender girl would have to know that they are identify that their gender identity is female before going through puberty, would have to have access to care and to be able to get on puberty blocking hormones. And the concern is that, in countries that, being LGBTQ is illegal, against the law, these girls certainly wouldn't have access to any sort of gender affirming care or testosterone blocking hormones. And then in the United States, we have 11 states where there are bans against providing gender affirming care to minors. And so let's say a transgender girl is growing up in the state of Florida, because it's a state that has both a transgender sports ban and a ban on gender affirming care. She wouldn't have access to gender affirming therapy or testosterone blocking hormones. So then she would be automatically disqualified from being able to participate in swimming or in track and field at the international level, simply because of the place where she was born. So a lot of the backstory or the impetus for these transgender sports ban is this idea of transgender girls and women having a biological advantage over cisgender girls and women. So if you think first about girls, transgender girls and cisgender girls, if you look at information and data from the Centers for Disease Control and Prevention, we see that height, weight, and testosterone levels between boys and girls is similar until puberty. So there really is no need to ban transgender girls from participating in girls' sports before going through puberty. So some of these transgender sports bans that start in kindergarten, so kids at the age of 5, really aren't necessary and are a bit of an overreach, because there is no difference between transgender girls and cisgender girls before going through puberty. And then to really dive into this issue, the Canada Centre for Ethics in Sports did a very comprehensive and in-depth systematic literature review because they wanted to understand if there was an advantage for transgender women participating in elite and high-level performance sports. This was just recently published, and it's titled Transgender Women Athletes and Elite Sport, a Scientific Review. The URL to access this information is at the bottom of the slide, and I really encourage you, if you have an interest in this area, to take a look at this review. Again, it's very in-depth, but based on the available scientific evidence, so the available evidence research that has been conducted, they conclude that transgender women who have undergone testosterone suppression, so they're on testosterone suppressing hormones, have no clear biological advantage over cisgender women in elite sports. They also are very clear that there needs to be additional research on this topic, as many of the studies that have been conducted to date are biologically limited and methodologically flawed. So a lot of the research that has been conducted in this area is either comparing cisgender elite male athletes to cisgender elite female athletes, or they're using data from people who have undergone or have used testosterone to enhance performance. So these are biologically flawed, methodologically flawed. And what they're calling for is really a lot more research to compare, and that compares transgender girls and women to cisgender girls and women at all levels of sports. I want to switch gears here just for a minute and talk about some of the harmful rhetoric. So Leah Thomas, she won the NCAA Division I championship in 2020. And with this win, Twitter exploded with anti-transgender messages. They accused Leah, of transitioning from male to female just to win. And she became an impetus to block transgender women from competing in elite level sports. Transgender women have been accused of, taking over and dominating women's sports. That's a lot of the rhetoric that's out there, that there's just going to be this massive influx of transgender women coming in and dominating, taking scholarships, taking away sport opportunities from cisgender girls and women, and just really dominating and winning everything in sports. I really like whenever Governor Cox is the governor of Utah, whenever he signed his vetoed the Utah's transgender sports ban, which was eventually overturned, he wrote a letter to the legislatures in Utah, and I really just would like to read that because I think he just really summarizes this all very well. He says, 4 transgender kids out of 75,000, and only one of them is playing girls' sports. That's what all of this is about. 4 kids who aren't dominating or winning trophies or taking away scholarships. 4 kids who are just trying to find some friends and feel like they are part of something. 4 kids trying to get through each day. Rarely has so much fear and anger been directed at so few. I don't understand what they're going through or why they feel the way they do, but I want them to live. And all the research shows that even a little acceptance and connection can reduce suicide significantly. For that reason, as much as any other, I am taking action to veto this bill in hopes that we can continue to work together to find a better way. So again, this idea that transgender women are going to dominate sports. If we look at the almost 500,000 student athletes in the NCAA, only 32 are openly transgender. And when we look at the 2020 Olympics, we see that only 4 transgender or non-binary athletes competed in that Olympics. Actually, the Olympics was held in 2021 because of COVID. And of those athletes, Lauren and Alana didn't medal, even though there's a lot of media coverage around Lauren. Quinn was a member of the Canadian soccer team, which took the gold medal. And Chelsea, she was an alternate on the US team and didn't even get to compete in the Olympics. So why am I talking about this harmful rhetoric? And this is an area where my research is really focusing. A survey of transgender and LGBTQ students found that 85% of transgender and non-binary youth had their mental health negatively impacted as a result of the surrounding debate around all of this transgender legislation. And again, a lot of transgender sports bans have garnered a lot of media attention. And so this has led to negative mental health among transgender and non-gender youth. And even just looking at the bigger LGBTQ community, so LGBTQIA plus youth, 66% of them have been negatively impacted by the rhetoric around all this anti-transgender legislation. My research has found that adults who identify as LGBTQIA plus and are familiar with the transgender sports bans that are being proposed at the state and state legislations have an increase in suicidality. So moving forward, banning sports participation of transgender girls and women denies them the benefits associated with sports participation. Just in general, participating in sports improves mental health, improves cardiovascular health, and reduces a lot of the risk factors for heart disease, such as high blood pressure, high cholesterol, diabetes. It improves bone density and lung function. Kids who participate in sports and adults who participate in sports have less loneliness and social anxiety. And specific to transgender adolescents, those who play sports are less likely to report depression and suicidal thoughts than transgender adolescents who do not play team sports. And we know that transgender adolescents are at a very increased risk for suicide compared to their cisgender peers. So they're about 4 times more likely to report having suicidal thoughts than their cisgender peers. So anything that we can do to decrease suicidality among transgender youth is a good thing to be doing. Just a few takeaways from the Canadian Center for Ethics in Sports. They recommend, based again on this extensive review that they did looking at this biological advantage that's been used to support a lot of the transgender sports bans, that sports should allow inclusion of transgender women and female categories in sports until there is robust and peer-reviewed evidence that it is not safe or fair for other competitors. And then Dr. Violin, a pediatrician and geneticist who studies sex difference in athletes, was quoted as saying, "There is no good faith reason to limit transgender women's participation in sport, especially at the high school level or lower. These laws are not based on scientific evidence, but target women who are either who have either different biology or who don't fit into the cultural accepted notions of femininity." So some of the key takeaways from this research is that transgender girls should be allowed to participate in sports based on gender identity, at least through junior high and high school. That state legislation that blanketly disallows transgender girls from participating in girls' sports is unnecessary and harmful. And that these policies or these bills should be rewritten to consider a holistic approach that includes what's in the best interest for all athletes. And these bills should be written with input from transgender athletes as well. And that we need more research that's methodologically sound. So we need research that compares transgender girls and women to cisgender girls and women at all levels of sports, rather than comparing cisgender men to cisgender women or looking at the results of people who are using testosterone to improve performance. So I'd like to conclude today's presentation with this quote from the Women's Sports Foundation, again, because I think it just really highlights the importance of inclusion in sport and letting girls and women participate in sports based on their gender identity. So they say, "Let us not lose sight of the most valuable aspects of sports participation, which goes well beyond the medals, to instill health and wellness, to build camaraderie and belonging, to learn discipline and leadership. Long after the race or game or match concludes, these are the lifelong benefits of sports that drive the mission of the Women's Sports Foundation, to enable girls and women, including transgender girls and women, to reach their potential in sport and life. These bills would unfairly deprive transgender girls and women of these critical development opportunities and experiences." And with that, I would like to open it to questions and thank you all for listening to my presentation.
Thank you, Dr. Pharr. And we do have some questions.
Okay.
So the first one is from Maddie.
Okay.
And she said, can y'all hear me okay?
I can hear you, yes.
Okay. She is asking a lot of these policies and viewpoints inherently assume that men function at a higher level than women in sports. While we know we have little research on trans participation in sports, what does the research say on cisgender males versus females in sports?
So if you look at high level, the research that's been done looked at very high level cisgender men and women participating in elite sports. And actually the study that a lot of these bands cite, the authors are like, oh no, we never meant our research to be used as research to develop policies because we had a very small sample size. And this showed that there was a difference between men and women, but these are men who aren't taking any sort of gender affirming care. They're not on any sort of testosterone blocking hormones or anything like that. But if you just simply look at men and women in general, we all have variations, right? And our body mass, our bone density, how much muscle we have, how much testosterone we have. And so because there's all of this variation, we really need studies that specifically focus on transgender women, so transgender women who have been on testosterone blocking hormone, looking at different periods of time for a testosterone blocking hormone, and seeing what the difference is there. That research, or the systematic review that was conducted by the Canadian Centre for Ethics in Sports, found that once a transgender woman had been on testosterone blocking hormones, that a lot of those differences that we see between cisgender men and women go away after a certain amount of time of being on testosterone blocking hormone. So thank you. That was a great question.
And Maddie also has a follow-up. She said, do we need to reconsider the way we categorize sports in general?
That's a great question, and there's certainly a call for that. Instead of having sex segregated sports, maybe doing things differently. And I think that, for me, my concern about this whole, biological advantage that transgender girls and women have a biological advantage over cisgender girls and women. At what point are we going to stop looking at biological advantage, right? I mean, if you look at elite athletes, well, they all have a biological advantage over me, right? If you look at, I know we're talking about transgender girls and women, but if you look at like Michael Phelps, just his body, right? He has a biological advantage because of his wingspan over other male swimmers. So where do we stop using this biological advantage and just let people compete in sports? And certainly before puberty, why do we have girls and boys sports, right? They are, the height, weight, testosterone are all the same. So why don't we just let kids play, just play sports, right? That aren't, boys, girls sports and girls sports. So that's a great question. And I think, where we're going with this, maybe that's going to be the end result. I know a lot of the concerns about this, or that transgender girls and women are going to take away sport opportunities for cisgender girls and women. And that's been an issue for a long time, that girls and women haven't had the opportunities to participate in sports that boys and men have had, right? And so Title IX, though it focuses on just all like educational opportunities, has really been, in the last few decades, specifically focused on sport and making sure that women have the same opportunities that men have. So I don't want to invalidate that concern, because that is a concern, but, maybe opening it up more broadly and finding ways to have fewer gender category sport or sex category sports might be a solution going forward. Thank you for that question as well.
And I have a question.
Mm-hmm.
So, you were talking about the 19 states that have the ban on transgender sports that are still remaining.
Right.
What recent actions are being taken to educate at the government level the 19 states who do ban transgender sports into removing the ban completely?
Right. That's great Great question as well. Some of the states, like the ones that have the asterisk next to them, so like
Yes.
Idaho, Montana, um, groups have, like the ACLU, have taken the state to court to get an injunction on the ban and try to, overturn or get the ban repealed. That's where, my research is heading. I would really like to create some, like almost a documentary talking to transgender athletes and coaches and cisgender athletes and just showing the humanity of transgender athletes, because I think that's what's getting lost in all of this rhetoric and all of this discussion and these bills, is the humanity of a transgender athlete. This idea that someone would transition simply to win a state meet or something like that, that's delegitimizing and not looking at the painful process of transitioning from, one gender to another. So, the realizing, coming to terms with that your gender identity is different than the sex that was assigned to you at birth, coming out to your parents, socially transitioning, medically transitioning. So much goes into this process that, and a lot, again, a lot of pain, and that just delegitimizes all of that a transgender person goes through. So I really think bringing those voices into the conversation is just so necessary to, again, to show the humanity of transgender people and why they just want to play sport based on that identity, the gender that they identify with. There's a great documentary. I'm totally blanking on the name right now of the documentary, but it follows three transgender student athletes through their, just, through a year of participating in sport. One of the athletes is a transgender male athlete, transgender boy, who lives in Texas and who's a wrestler. And wrestling is life-saving for him, right? It's how he connects with people. It decreases his depression, anxiety, all those sort of things. So he wants to continue to wrestle. But because the transgender sport ban in the state of Texas won't allow him to wrestle in boy sports because he has a female on his birth certificate, he, even though his transition, has to wrestle with girls, which is very demoralizing for him and also for the cisgender girls that he's competing against.
Thank you. And Dr. Vissing would like to add on to my question.
Okay.
How do we go about dealing with the states that are hostile towards transgender youth? What's being done about that?
Yeah. Again, there's 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 not a lot being done about it. I think, gosh, every day when I turn on the TV or listen to NPR and I hear about, another state passing a transgender sport ban, or another state that's illegalizing caring for transgender minors, so making it illegal for doctors to provide transgender care, parents to seek transgender care. I just, I have to keep my optimism that by sharing these stories, again, I think it's a lot of this legislation is being driven by people who are cisgender, and they just can't even conceive of the fact that you might identify with something different than your sex assigned at birth, right? And so sharing stories and information, I think it's impactful, and it can change hearts and minds. And so I think that is going to be the way forward. As academics, we like to give a bunch of statistics and stats and that sort of thing, but it doesn't tell the story as well as someone telling their story. So I think we just need a lot more of that, but not a lot is being done. Not enough is being done in the states that are hostile towards transgender kids, towards LGBTQ kids. Yeah, so I think we just need a lot more work in this area.
Thank you.
Yeah.
Are there any more questions? We have about 4 minutes left. Any more questions or comments? Well, if not, thank you, Dr. Pharr. Can you just impart on us your wisdom in the next 4 minutes, like takeaways for us as far as your wisdom wise?
Yeah. I think I've been asked by colleagues, why this is something that I'm passionate about. And I really think that, when I hear the rhetoric, I identify as a cisgender woman, but I also identify as a lesbian. So I'm a part of the LGBTQIA plus community. And it impacts me just being someone who doesn't fit into the cisgender heterosexual normative culture, right? And so I can only imagine how impactful this is to a transgender kid out there hearing, legislatures talk about them in derogatory ways or vilifying them and things like that. And I just, an ounce of compassion, I think, would go a really long way in this area. And my research is looking at how all of this rhetoric surrounding all of the anti-LGBTQ legislation that we're seeing in our country right now is impacting the mental health of this group of folks. The ACLU tracks how many anti-LGBTQ plus legislation uh, bills are being circulated in the United States. Right now, it's over 430 bills are being considered in different state legislations. So not just transgender sports bans or bans against transgender adolescent care, but all sorts of bans that are excluding, members of our population, excluding members of the community, right? The
Right.
community of people in the United States. And I just really think that the health impact, the mental health impact of all of these types of legislation really need to be considered as legislators are proposing these different bills and laws and policies.
Well, thank you so much.
Thank you. It's a pleasure.
And that concludes our session with Dr. Pharr on transgender sports bans are a human rights issue under transgender athletes. So thank you.